Well, thank you for the invitation today. I have a few slides, but I don't intend for this to be an overly formal presentation. I mostly want to introduce some of the efforts that are being made in the public health and engineering community to track COVID in our public water supplies, and just open myself up for questions. I think this has been a lot in the news. I've seen it on a lot of evening news. I've been interviewed myself by news agencies. So really, I'll make myself available to sort of answer questions. I will show a few slides, just I think some visuals will help. Um, Let me get this machine going here. And if someone can tell me that it's coming through.
It's coming through.
Great. My name's Belinda Sturm. I'm a professor at the University of Kansas, and Justin Hutchison is working with me on this project. He's also a professor here. I specialize in wastewater treatment, so a little bit out of the groundwater space. In that area, I really focus a lot on the biology of wastewater treatment, how to make the bacteria do the work of cleaning up the water. So I have a lot of experience with biological methods. I am not, before the last 9 months, specializing in tracking viruses in water, but it's, in my toolbox of things that I can look for if I know what I'm looking for. Just to kind of start, I'll say that the area that's being leveraged here in the public health space is the idea that in communities we have wastewater collections infrastructure. And this is a snapshot of the master plan from Lawrence, Kansas. Every community will have one of these, but we're thinking very much about, every toilet is connected to the sewer system. And you have a series of pump stations, and you have the influent wastewater treatment plant, or in a lot of the communities I'm working for, lagoon systems that are basically collecting stool samples from any toilet connected to that system. So as we're trying to track COVID, there's a lot of testing campaigns where we try to get individuals to come into an office and to be individually tested. But really what this is trying to think about is, okay, well, all of these people are depositing human specimens into the sewer system. Can we leverage that infrastructure to understand how many people in that community are sick? All right, so this is really thinking about pooled sampling. This is being termed wastewater-based epidemiology. It's not a new term. It just hasn't been widely looked at for monitoring public health. In the past, what wastewater has been looking at, it's been used to track illicit drug use in the same fashion. Like, you want to understand how prevalent drug use is, you can look for how much of that drug is in the wastewater. That's not as common in the United States. It's been proven to be useful in certain arenas. It has been used to look for the disease outbreaks of enteric viruses. So these are viruses we expect to cause diarrhea, and we expect to find them in human wastewater. Norovirus, hepatitis A, poliovirus. When the Ebola concern came out about 4 or 5 years ago, there was really an awakening of this, because the concern was that if we had active Ebola patients in the United States and they shed that virus in wastewater, would that virus in wastewater be infective? And mostly we were concerned about all of our workers who work in public works, right? So the operators of the wastewater treatment plant, plumbers, folks who may have to come in contact with raw sewage. So the community started to look at virus detection a little bit more. And so we were prepared for SARS-CoV-2 to say, okay, can we look for this? I want to say, because one of the big questions I get, well, can you get COVID from wastewater? And our current understanding is that you cannot. All right, so we're not looking for infectious viruses. That was one of the first questions that needed to be answered right away, because we have a lot of people who work in the wastewater industry, and we wanted to make sure that they're not, that's not an additional concern for transmission. That said, when people ask me, is wastewater safe? The answer is no, raw wastewater is not safe. Raw sewage is not safe to be around, to sort of have go into your mouth or any of those routes of transmission. But we don't understand that this respiratory virus can be transmitted through wastewater, but we do think we can find evidence that it's infected people. All right, so these are just some news things that you may have seen some news similar. Some universities have used this on dormitories to understand how much of their student population has been sick. The Center for Disease Control, and this was sort of put up in August of last year, they've started something called the National Wastewater Surveillance System. This is really in its infancy, and I don't know where this is going to go post-pandemic. But I think the federal agencies have really understood the manpower and the expertise in the wastewater field and the water field to track viruses and populations. So, I'll sort of step back and go just a bit into the science. SARS-CoV-2 is a respiratory virus. It's not an enteric virus, but in human samples, it has been shown to be shed in stool. So this is some data that came out of a hospital study in Munich, Germany. It came out in March, almost a year ago now. So just when the novel coronavirus was being first studied. And what it showed is sputum, which is the mucus that you cough up. The concentrations in sputum were similar and decayed about the same rate as they did in stool samples. So this enabled us to look in wastewater for evidence of human infection. The other thing that this study pointed out to us is that people would shed the virus for up to 3 weeks after they were infected. So that is important because it means that if we take a wastewater sample and we observe the virus in that wastewater, it doesn't mean that someone is just in the most infected phase. It means that they have been infected within the last 2 weeks to a month, and that we are still seeing them shed the virus. So, where this is at in our water system, you can take a wastewater sample anywhere along collection, and it's going to tell you something about the people who are connected to that sewer collection system upstream. So the term that's gotten touted about is called a sewer shed, right? So the same concept of a watershed, but we're really thinking about the sewer collection point. That could be the outlet of a dorm or the outlet of a building, or it could be a manhole that's connected just downstream of a nursing care facility. A lot of the work we've done is at the influent of a wastewater treatment plant. So everybody in the sort of community that's attached to the influent. I think it's also important to emphasize that we're not looking at the effluent. We're not looking at what goes into the river, the discharge. So the concern is not for us to be worried about infective COVID-19 in our water supplies, because there's no evidence that this can be infection can be transmitted through water. It's a respiratory illness, but we're looking at the influent of the plant basically as a pooled sample for the community. So there have been quite a few studies in this area that have been published in the last 6 months. This is one that got a lot of press early on. This came out of New Haven, Connecticut. The black line is the number of COVID-19 cases that were reported in their public health. And the red line is the virus concentration in the wastewater. And what they showed is that they had nearly a perfect correlation of concentration of the virus in wastewater and COVID-19 case data, but more importantly, that they had a 1-week lead time. So the idea is that you could detect the virus in wastewater up to a week before people were symptomatic and were asking to be tested. So that gave a lot of hope for public health, so that we would have a little bit of lead time. A lot can happen in a week. You can tell your community that there is active virus in the community, that you need to take precautions, whatever those interventions may be, if they'll be mask or distancing or school closures. But the idea of having a 1-week lead time, and that you could understand that before people were actively seeking medical help, really got a lot of communities and states asking, can we test our water supply? Right. And then I'll pause after this slide and see if there are any questions at this point. I want to say that there's a lot of potential for these methods. And this is a slide that came off of the Water Research Foundation, which is a professional organization that gathers wastewater professionals. And it sort of went through what are some possible uses for looking for virus and water supplies, and then where are we at currently with our current understanding and feasibility of these. So I'll kind of go through each of these, and I'll speak to where the state of this is in most of our communities. So the first is to look at the wastewater concentrations and understand trends. Is the concentration increasing? Is the concentration decreasing? Are we on the right path? You can imagine now that vaccines are being distributed, that we may look at this and we may say, okay, are we really, vaccinations are going up, or maybe there's some pockets of communities that aren't being vaccinated either for availability or choice. Are we really decreasing the prevalence of SARS-CoV-2 in our community? That's feasible right now. So we feel good about detecting the increases. You'll notice that detecting the decreases, our community gave just sort of a half-hearted feasibility, because again, people shed the virus for up to 3 weeks. So even if infections are going down, it's going to be a little bit of a lag time before we see those decreases in the wastewater, right? So people could be over their infectivity phase, where they're not actively transmitting infectious virus, but they could be still getting it out of their system, right, in the stool. And so detecting increases is very feasible. Detecting decreases is feasible, but there's going to be that understanding of a lag time, that it's not going to be the immediate gratification that the increases we'll see. The second use is obviously, okay, well, if we can detect the concentration in the wastewater, can we back calculate how many people are sick, right? So can we determine prevalence? And that is theoretically possible. And we don't nearly have enough data for us to give that number with confidence. So I can write out the calculation of how I would do that, how I would go from concentration to number of infected people. And if I put error bars around that, you lose your, I think, your public health meaning of it, because there's a lot of uncertainty. Most of that uncertainty is because people shed the virus at very different rates. And at different rates after they've immediately been sick, when they're very sick, versus 3 weeks later when they're getting better. So the shed rate of how many viruses you shed in wastewater has a lot of uncertainty to it, and that leads to a lot of uncertainty in our calculation of community prevalence. The risk assessment, again, from the wastewater community, we really want to keep our workers' safety. Safety is always first. Really trying to use this to understand the risk to utility workers. That's getting better, as we gain more knowledge. But I would still say that that's a little bit it's a little bit difficult right now. And I can go into why it's difficult. Viral evolution. So just within the last 2 weeks, this mutation in the virus that has been observed in the United Kingdom and now has been observed in several states in the United States. When we look for the virus, we've been looking at the specific CDC primers. But if we wanted to sequence the entire viral, we can look for viral evolution. I'll tell you that I'm not currently doing that. That costs quite a bit more money to do sequencing and to do that. But certainly nationally, we go through the trouble of getting these samples, of collecting the virus. And people like me, like in my freezer, I have probably 1,000 viral samples from all across the state of Kansas for the last year. So, if we ever wanted to, we could crack open my freezer and look for those mutations. I'm just not looking for them right now. So I want to pause for a moment and ask if there are any questions about this, and then I could show you some of our efforts in Kansas here, but that's sort of an overview of what we're doing with wastewater-based epidemiology. And I'll kind of open up the chat and see if there are just some, I don't know you, I don't know this group. I don't know if you're shy or if you just shout out questions. So you could give me any impression of yourself right now and I'd believe you.
Belinda, this is Jim Chiaffi in California. Could you repeat your thoughts about the risk assessment to the utility workers?
Yeah.
Thank you.
Yeah. So the reason why this is hard with this method is when we look for the virus, what we are detecting is the RNA. We're detecting the genetic material. And that says nothing about whether it's infective or not. So strictly speaking, with the methods we currently do, I can only tell you that the virus was there, but I can't tell you if it's possible to make you sick, right? I always say it's kind of like when you watch CSI, like you can detect the DNA and at some point it was there, but you don't know if it was alive when it was there. So strictly speaking, with the methods today, we cannot say that it's not infective. We're going to have to do some more steps to do that. So that's why this wasn't given 2 pluses. If we develop some additional lab work, we might be able to get there, but currently we can't.
Thank you.
Mm-hmm. Thanks for asking a question. Anything else before? I'll show you some data. I always like to see data, but this is sort of some numbers.
Belinda?
Mm-hmm.
We had a question about, what's the opportunity for COVID, the virus, to spread to groundwater?
Yeah, so that's a great question. I would say that I'm not concerned about this at all today. I think no one has found when we collect a virus from wastewater, No one has found that virus to be infective. So we may find SARS-CoV-2 RNA in groundwater, that I believe. Like I think, especially in an alluvial system or a well-connected surface water, groundwater system, we may find, or a septic, system, we would find SARS-CoV-2 virus or RNA in the groundwater, but I would not be concerned with it being able to give the disease COVID-19. That's not true for other viruses, right? So for enteric viruses, for waterborne pathogens that can survive in wastewater, that would not be true. But for COVID, because it's a respiratory virus and there's no evidence that it survives in a water system, I'm not concerned.
How long does the RNA last in water?
Oh, that shouldn't be such a difficult question, but I think, so I put RNA in the freezer and it will last for years and years. So depending on the temperature and how many solids and things, it could be detected for a long time. But because I want to measure, like samples that get shipped to me, I try to analyze within 24 hours because it starts to decay. But I wouldn't say it goes away, especially in a cold groundwater system. It could stay around for a while.
So potentially it could be used for a tracer.
It wouldn't be the tracer I would use because it does decay. So I like chemical tracers better for sure. But yeah, I think in terms of, it's much more common for us to look at E. coli or norovirus or adenovirus or some of the enteric viruses. Those have been used to show evidence of septic contamination of groundwater, certainly.
Belinda, this is Gary Beard in Louisiana. Have any of your tests looked at the reduction or possible reduction of the virus through the treatment process itself? In other words, it measured it effluent prior to disinfection. I'm sure disinfection, especially with chlorination, takes care of most of that. But.
Yeah. So I initially did a few samples of effluent and they were all non-detect. And so, as they should be. So I haven't repeated.
That was prior to disinfection or post-disinfection?
Post-disinfection, they were all
Okay.
non-detect.
Did you take any prior to disinfection?
All of my samples are, so let me go back because if you're not familiar with the treatment train. So all of my samples are on the raw influent. I haven't taken any intermediate along the treatment train. I've done influent and then I've done after disinfection, but I haven't looked at like sedimentation or any of that.
No, yeah, I knew that post-disinfection, you probably had 100% kill, whether it was UV or chlorination, but I was just curious, did you take any samples prior to disinfection, past all bioprocesses to see if there was any reduction?
Yeah, I didn't, you're asking me these questions, so I know you know the answer to this, but I'll repeat. The American Water Works Association has put out a statement because obviously everyone is concerned about this. When we meet our disinfection standards in drinking water, it's much harder to disinfect bacteria than it is viruses. So the assumption and all evidence to date is that if we meet our disinfection for bacteria, we take care of viruses. And SARS-CoV-2 does not seem to be unique in that.
Okay, thank you.
Thank you.
Belinda, this is Orrin Farrell, Kansas. And forgive me if this is a simple question or ignorant question. With the rise in vaccinations going through, would those be shed in the stool as well that would then give potential false positives. You know, if you're looking at the wastewater as a tracer or a marker for infection rates.
Yeah, no, it's not a simple question. It's one that we've all asked because, you know, obviously vaccines were developed to take care of the disease, and we've all gotten the information in the wastewater community. Current understanding is that it will not be shed in the stool, that it will create antibodies, and the gene that I'm specifically looking at, if you don't mind, I'll go. I didn't want to go into too much, but these are different pictures of different viruses. And the coronavirus, which we've all kind of gotten used to looking at, it has these spikes off of it. So I'm detecting that spike protein, the RNA that makes that protein, and the vaccine doesn't do that. So I shouldn't be detecting. Now, that said, I am in one of my communities. We're looking at manholes south of nursing homes. And over the next month, I expect all of those residents to be vaccinated. And I will know with data in the next month that that is true. And I'm looking forward to having that data.
Thank you.
Mm-hmm. So I put these pictures up here. I wanted to tell you all that I think Mark, when he spoke to me, asked me a really great question. He was like, well, do you think we'll continue? I can't remember the exact question, but what lasting impact will this have maybe for our field? And we all hope that COVID-19 goes away and we say goodbye to it and we're good riddance, and that we don't have another pandemic like this for the next 100 years, right? If this is going to be a 100-year event. But what I think the lasting effect has been is that our field, all the engineering community is really mobilized to respond to a public health threat. And I think the fact that we're all using our biology, our DNA tools, that we'll be ready to maybe look at enteric virus contamination and track that. Not all viruses are the same. So that's the point of this slide. So they have lots of different shapes. They have lots of different sizes. They're actually incredibly diverse when it comes to their genetic code. Some of them have DNA, some of them have RNA, some of them have envelopes, some of them don't. So, someone like me, an academic, could make a career studying these things. I look forward to going back to wastewater treatment at some point. But we are looking at the genetic code, and everything has a genetic code. So moving forward, I think anything we're interested in looking for, that will have many more people who have the tools to look for that. So, if it's E. coli, if it's norovirus, if it's Giardia, anything that we want to know if it's there, there will be many more labs that can look for that and answer that question. So I'll end with some data. Do we have time for me to show you one more slide of data?
Sure.
Okay, so this is Johnson County, which is the most populous county in Kansas. And we've been partnering with Johnson County Wastewater, the public utility. They have 6 treatment plants. They're in the diamonds. And the blue outlines are their sewer shed for each of those treatment plants. And then this is Lawrence. Lawrence is much smaller. We have 2 treatment plants, and those are the sewer sheds for each of those treatment plants. So we've now been doing weekly sampling of these plants since June. And we have created partnerships with our county public health offices to send them the data every week. And they use it as one of the things that they consider as they think about how to manage the public health crisis. So we have a public dashboard for this in Lawrence. And, you know, you could stare at this data for a long time and maybe have some fun or go crazy, but this overlays the green line as the case data. And we've been up and down in Lawrence. And then the dots are the wastewater concentration. And so, you know, we're kind of digging into this data, but I wanted to show you the correlation matrix here. And let's just look at the first line of the correlation matrix, but this shows you the wastewater concentration and how this correlates to the case data. And you can get a sense that it does correlate, and that it correlates best when we look at like a 21-day rolling average of the case data. So, you know, I've used this to talk to our public health, and really, like, we are now upticking after Christmas. Our concentrations are going up, and we feel confident, unfortunately, that means our case numbers are going to start going up. And we're just kind of using that data to really be thoughtful and communicate within our local paper to folks, especially as students come back and we think about what that will do to our community. Across campus, I've worked across Kansas. I've worked with Kansas Department of Health and Environment, and we've sampled at small treatment plants and small lagoon systems across the state. And this doesn't show you the concentration data, but red is the most concentrated. Some of the highest concentrations we observed are in our smallest systems. And some of that has to do with there not being a dilution effect, right? There's not, and some of it has to do with there are pockets of high case numbers that we've observed in these small communities. So that's what I had prepared today. And again, if you have any questions, I'll answer them or I'll be quiet. I
I have a
Hey,
question.
Belinda. Oh, sorry.
I
I'll
was
go
wondering if any of your colleagues have determined that there's something unique about this this virus in how it seems to affect so many different people at different ages and different health so different, you know, so differently. It doesn't seem like there's a lot of consistency as far as, yeah, you're going to get sick or no, you're not.
Yeah, I am. You know, I don't. So I usually joke, I know a lot about biology, but I know very little about humans. I'm out of my wheelhouse when we talk about human medicine there. So I have the same question. I'll tell you, I live in a household of 6. We have 3 generations in my home. I have 3 boys and my father lives with me. And I think about that daily because I think my boys will be okay and I think my dad would not. So that is a frustrating thing about this virus.
Hey, Belinda, this is Dick Urban from Nebraska. Boy, really great stuff. And I apologize. I've been furiously taking notes here. So if you already answered this question, I apologize in advance. But lately we hear a lot about these new mutations, the British mutations, South Africa, all that sort of stuff. Is there any work going on to try and distinguish those mutations through wastewater? Would that be helpful? Is that planned? What's going on there?
Mm-hmm. So there is no reason that we can't use our samples to detect those mutations. I think it comes down to a case of funding. So the methods I'm doing right now are relatively cheap. I understand for the people paying for them that it costs them money and it's real money, but they're relatively cheap. But when we go to sequencing, the price tag jumps exponentially. This is where federal funding is really needed. A lot of my sampling efforts have been locally funded by Kansas and by the utilities. And I think some of them benefited from CARES money to fund that, but sequencing, that's going to take a deeper pocket. Now that said, the mutation from the United Kingdom, that sequence has been published and I've already ordered the primer. So I do intend to look for that mutation in some of my past samples. I'm just gonna do that out of curiosity.
Well, one of the things I might chime in and say is certainly after this information and meeting Belinda and the common experiences that we all have had through COVID and COVID conversations, I can't help but think through the funding that we keep talking about regarding water and water quality, and to what extent some of our discussions on the Hill and with NWRA and others might want to think in terms of advocating and underwriting for additional funding for the work like Belinda's involved with. So I can't help but think in those terms, and I just throw that out there as we look ahead. And I certainly thank you, Belinda, for all the information, taking some time today. Wow, the work that you're doing is phenomenal, extremely interesting, and I just wish you the best in all of that endeavor.
Yeah, well, it's one of the projects that you hope that you have to end soon. So I'd love it. I'd love it if the problem went away. All right. Well, thank you I hope I didn't take up too much time, and enjoy the rest of your meeting. Okay.
Thank you very much.